All right, so building resiliency of the adductors in a lengthened and provocative position. So knees nice and wide as you can go, so you start to build tension within the tendons, that is within the groin. And then you're going to sit back into it to build further resiliency or tension there. Great. So your first minute is going to be passively finding that tension, doing some nice deep breathing, 4 seconds in, 8 seconds out. We're going to expedite time. After your 1 minute, you're going to start to generate force where your both knees are driving into the floor, as if you're going to bring the knees together and clamp something between your legs. That's great. Keep that up. And it's disconcerting because nothing's happening, but you're doing a max contraction here, which builds tissue resiliency. So when sport and life demand your hip be in this position under load, it's got some experience here so that you can dissipate that force and prevent injury rather than the tissue breaking underneath it. Great. After 30 seconds of max contraction, you do the opposite. We're actually lifting your knees up, if you could imagine that. Yep, and you can see the glutes starting to flicker and fire there. And this one's really funny because you can't actually get your knees off just because of the position. But the more force generation you can produce, the more effective and thus the more resilient the tissue will be when life and sport demand its positioning in this provocative position where the adductors are really put under a demanding load. Great. And this is going to be hard to generate force, but over time in practice, your glutes are going to actually start to not flicker here, but get a full-on volitional contraction, which is simply a representation that you've trained your brain sufficiently that it can actually get in and out of this position.